Back surgeons now have a new device to help ease their patients' pain, and it was developed and invented by a UConn student. It's gotten one New Britain man up and around again.
Bend down and touch your toes, go slow. Excellent, excellent motion there.
Dr. Jeffrey Bash is witnessing progress in his patient, John Terracani of New Britain. John came to the spine surgeon after nothing else worked to ease his extreme back pain, all from a career of loading and unloading a truck he drove.
If my back went out, it took me roughly 3 days to get back. And I just worked right through it. I didn't bother laying down. If I did, I'd be out for 3 weeks.
He wasn't able to do things we do. Even going to the mall, he'd have to use his walker.
Dr. Bash shows us one of John's problems using a model. The green plastic pieces coming out represent nerves.
The spine should look like this, with the nerve coming out the side with no compression upon the disc.
But John's nerve was pinched. Dr. Bash's job was to relieve that pressure, and he got access to John's spine using this new light-up tube called a Lumiere Retractor. Dr. Bash says this has clear advantages.
It's actually safer for surgery because you can see the other parts of the nerve and spinal cord when you're operating.
And the device can be used for other really painful conditions, things like herniated discs and bone spurs that lead to sciatica.
The Lumiere Retractor was invented 3 years ago by then 21-year-old Joshua Averzon of Connecticut. Averzon received his first patent at 16 and went to UConn studying biomedical engineering. Dr. Bash says the Lumiere has led to major advancements in a patient's recovery.
A spine fusion from the traditional approach or open approach would be in the hospital from 5 to 7 days. With this approach, many patients can go home within a day or two.
As for John, no more pain pills or a pain level he says was over a 10.
It's great. It's down to 0.
Great. So John no longer needs his walker. Back surgery is a last resort. Patients like John try chiropractic help and physical therapy first. So a young Connecticut inventor there to the rescue.
Yeah, great story.